It's always a pleasure and an honor to be here. I love doing this because we all grow, we all learn, and even myself, as old as I am and as long as I've been here, I still learn new things. Before I get started on the videos, I have a huge favor to ask of everybody who works in the trauma unit. For those of you who've been in the trauma unit for a long, long time, historically, there's been a strenuous relationship with the trauma unit and the paramedics. And lately it's escalated where I have met with Melanie Dotson, the base hospital coordinator, to find out what it is that they're upset about. What is it? Years ago, the chief resident would always be questioning what the medics were doing in the field. They are not allowed to be doing that anymore. And during their orientation, Dr. Godak will tell them you're not to question the medics as far as what they did in the pre-hospital, not to give any negative feedback. If they have something to complain about, they are to email me and I'll look into it and hopefully it will resolve. So when I met with Mel, I said, what is it about them that they don't like about us? And they feel that they're being ignored. They're not being recognized. And I look at a lot of videos and everyone's doing their thing. I know all of you are listening to report because you're documenting what the medics did, but we're just not acknowledging them. So I'm going to ask that when they finish report, just say thank you. Just say thank you. If they give you a great pre-hospital report, hey, thanks for that great report. That's all I'm asking you to do right now. Dr. Coimbra has already met with the chief battalions in San Diego County to just better the relationship with us and them. I am going to every single orientation for the medics and explaining to them what we do and why we do it the way we do. They don't like coming to the second floor. Well, yeah. I tell them that's the best place for them instead of the ED because the nurses are highly trained, there's consistency of care, and everything is on the second floor. The OR, blah, blah, blah. That's one thing. And another thing that they don't like is that they'll say in their report that no T-spine, no C-spine tenderness. What do we do the first thing? We put them in spinal precautions. Yeah. So I'm going and explaining to them, this is our protocol. We have to assess the patients. How many times have they said, no C-spine, T-spine tenderness, turn around and then you do the assessment, they have pain, x-rays, and there's a fracture. So I explain everything to them. And I tell them, even though the nurses and the physicians are not looking at you, trust me, they are listening to every single word you say. So on the physician part, Dr. Coimbra is addressing that with the residents and the attendings, and so I'm asking you, just say thank you. Just look them in the eye. You know what it's like to not feel appreciated when you do a good job, so they feel the same way. So thanks for that. Any questions on that? Yes.
Is there any way, because they want to move the patient over while they're giving a report, and we want to listen to the report and then have them move the patient, is there any way to get that out there to the medics? Because
sure.
I know I can get other facilities, they move the patient as they're talking, and then we say, can we move them after?
Right, and I think it depends on Doc 1, right? He or she, they want to move that patient over, but they're taught. Unless the patient is having an airway problem or CPR in progress, everyone is supposed to stop, give them that 45 seconds to do their report and then move them over. So you as a trauma nurse can say, let's wait until they're finished their report and then we can move them over.
We have to tell them that every time, but I think the medics, they don't know that if they come to our facility, we want to listen to what they have to say and then move the patient. Is there any way to get that out there?
Sure. That would be good to bring up to Melanie when she comes later this afternoon. Okay. And I'll spread the word when I do the orientation. Okay. A good point.
Thank you.
Something else? Yes.
I do 2 Saturdays ago, and I don't know if Melanie can speak to this. There was a nurse covering the radio, and she did not handle the radio. We had 4 unannounced. And when the paramedic came up, said it was very frustrating because the nurse could not decipher whether she was going to make it a resource or a trauma, and he waited for 15 minutes and then it just came up. So
That's been looked into. I haven't forwarded it to Wanda yet. I just have a stack of stuff to do, but she's already looked into it. Bring that up with her when she comes this afternoon. Just to let you know, not that I'm making an excuse for anybody, we're all much more busier. Their calls have increased to 3,500 a month. That's the highest it's ever been for UCSD.
yeah, she just said the phone got away from her.
Yeah, so if you can imagine being on the phone and trying to take care of a patient, get orders, and sometimes when it's multi-casualty, if you can imagine being on the phone with that. So I'm not making an excuse for that, but but every single time you document that the patient arrived unannounced, an email automatically goes to Melody. And I always CC Wanda so she knows that I'm looking at this. And so it's up to Wanda if she wants to give it to the resource. So but I always let her know. And sometimes it's medic error, sometimes it's MICN error. It just kind of depends. Again, I'm not making an excuse for them, but we do look into every single one. No shows, that as well. And a lot of the stuff, some of the excuses I've heard that, the medics got lost. Okay, so every time that happens, we look into
Well, I
it.
was
So
just speaking to maybe that's causing some of their frustration as well, because he said he was waiting outside with the other ambulances.
yeah,
And there was
yeah.
no decision, so he made a decision himself.
Yeah.
He had to.
If you think about too, sometimes it's a really short ETA. Sometimes they're waiting for a physician because it's a physician order to make it a resource. It's not an MICN. It's the physician. So when they're waiting, they're just kind of on standby. So, all right. Any questions on that? So I appreciate that. So
Is the relationship between the medics and us getting worse, you say?
I would say the last couple of months it has.
Because I feel like we always tell them things. I feel like when we're in the trauma bay, I don't feel like we have that tension or that, I feel like we have a good rapport with them. Like, oh, you guys again. Like,
Well, that's good. I mean, and maybe it's
how many times are you guys gonna come?
maybe it's that group of medics, but there's some stuff that's been a little, it was uncalled for. So we had to look into that and push it forward to Melody and the chief battalion for that agency. So it was uncalled for.